today we are going to learn about quinolones. These are a group of antibiotics that come under antimicrobials. They have two categories, nalidixic acid and fluoroquinolones. These drugs are bactericidal in nature, which means that they completely kill the bacteria. Now, under this video series, we are going to divide the drug under at least four categories: mechanism of action, susceptibility or susceptible organisms, resistant organisms or the mechanism by which the organisms acquire resistance, pharmacokinetics of the drug, side effects or adverse effects of the drug, a few examples, and also uses of the drug. Alright, so let us now start with the mechanism of action of quinolones. Quinolones inhibit the bacterial DNA gyrase. Now, DNA gyrase, as you might remember, is involved in the unwinding of bacterial DNA, which is essential for bacterial DNA replication. DNA gyrase is also known as topoisomerase 2 in gram-negative organisms and topoisomerase 4 in gram-positive bacteria. Okay, so DNA gyrase has two subunits: subunit A, which is responsible for nicking and resealing of the DNA, and subunit B, which is responsible for negative supercoiling of the DNA. Both these subunits are important in the action of DNA gyrase because, like we said, subunit A is responsible for nicking and resealing of the DNA strands, and subunit B brings about negative supercoiling, which counteracts the positive supercoiling that the DNA strand undergoes when it is unbound. So as quinolones inhibit DNA gyrase, they inhibit the process of bacterial replication, and in turn this leads to the death of the bacteria, which is why these drugs are bactericidal in nature. Now coming on to the susceptibility, these drugs act on all aerobic gram-negative organisms mainly, like E. coli, Klebsiella pneumoniae and Shigella. Moving on to resistance. Resistant organisms are Bacteroides fragilis, Clostridia and many more. The mechanism by which they acquire resistance is by chromosomal mutation, which produces a DNA gyrase with reduced affinity for fluoroquinolones, or increased efflux of the drug, which will reduce its efficacy. Alright, so let us move on to the pharmacokinetics. These drugs are rapidly absorbed orally, but food may delay their absorption. They also have very good tissue permeability. Now, the concentration of the drugs in lung, sputum, prostate and phagocyte highly exceeds their concentration than in plasma. They are excreted through urine, and their urinary and biliary concentration is almost 10 to 50 times more than that in plasma. These drugs also show a long post-antibiotic effect, which means that even after the drug has been metabolically eliminated from the body, it still continues to show its effect for a long period. Now, before moving on to the adverse effects and the uses, let us look at the examples first. So we saw that under quinolones we have two categories: nalidixic acid and fluoroquinolones. So nalidixic acid is the sole member, and under fluoroquinolones they are divided under two generations: first generation and second generation. Let us look at the first generation fluoroquinolones. They include ciprofloxacin, norfloxacin, ofloxacin and pfloxacin. You can remember this with the help of a mnemonic COP-N. Coming on to the second generation fluoroquinolones, they include lomefloxacin, levofloxacin, sparfloxacin, moxifloxacin and prulifloxacin. You can remember this easily with the help of the mnemonic PSM-L square. Now, I don't know about you, but I'm generally late for classes. And if I'm late for a PSM class, and that too 2 days in a row, it becomes PSM-L square. Simple. Now, before looking at the side effects, it would be better if we came on to the uses of the drugs. Coming on to nalidixic acid, it is a narrow spectrum antibiotic in comparison to fluoroquinolones, and it is mostly effective against gram-negative organisms, as we just saw, like E. coli and Proteus. Therapeutic concentration of this drug is achieved in the gut and urinary tract. It is understandable that if the drug achieves therapeutic concentration in gut and UTI, then it will play its part in diarrhea and UTI. Thus, nalidixic acid is effective in conditions like UTI and diarrhea. Coming on to first generation fluoroquinolone and the most important fluoroquinolone, ciprofloxacin. This is the prototype drug of this class. So now ciprofloxacin, it is the susceptible organisms are Enterobacteriaceae, Salmonella and Neisseria. Pharmacokinetics of this drug is, we just saw the main features, so it's the same. It has a rapid action and it has very good tissue permeability and it can be given through the oral route. Now let us look at the conditions in which ciprofloxacin can be used. Now it has many uses, all of which are extremely important. So you can remember them easily with the help of the mnemonic wet bug's bite. From W, it is effective against wounds. E, it can be used in eye infections. T, you can convert it into TB like this. It is used in cases of multi-drug resistant tuberculosis. From B, it is effective against bacterial endocarditis. U for UTIs, G for gonorrhea, S for septicemia, B bite, you can write it in this way. So BI is for bone infections and TY is for typhoid. Notice how we can correlate this with the pharmacokinetics. We just saw that therapeutic concentration of fluoroquinolones, that is the concentration of the drug, is much more in lung, sputum, prostate and phagocytes than in plasma. So this can be correlated with the uses as well. Okay, so we should talk a little bit more in detail about typhoid. Ciprofloxacin is a very effective drug in case of enteric fever because it produces quick defervescence, which means that it quickly brings down the fever of the person and it has less complications or side effects, and it can eliminate the carrier state that occurs in enteric fever. The dosage is also important, so we give 500 to 750 mg of the drug twice a day for 10 days. Okay. Now, norfloxacin is given in cases of UTI and diarrhea. Ofloxacin is given in cases of tuberculosis, leprosy, and respiratory infections. Pfloxacin is given in cases of systemic and meningeal infections. Alright, so now let us look at second generation fluoroquinolones. Lomifloxacin is banned. Levofloxacin is given in chronic bronchitis, pneumonitis, and multi-drug resistant tuberculosis. Moxifloxacin is given in multi-drug resistant tuberculosis. It is the second line drug. Both of these drugs, levofloxacin and moxifloxacin, are the second line drugs for tuberculosis. Second line drugs are those drugs which are used when the drugs of choice for that particular condition have become resistant. That is, they no longer are effective in that condition. So then we resort to second line drugs which can be used in their place. Prulifloxacin is used for chronic bronchitis and UTI, and sparfloxacin is useful against leprosy and MAC, that is Mycobacterium avium complex. Okay. Now lastly, let us look at the adverse effects of these drugs. Nalidixic acid has mild side effects like GI upset and rashes, but a very important side effect is that it affects GABA. GABA is an inhibitory neurotransmitter in the brain, and thus the side effects that it causes are restlessness, seizures, headache, and drowsiness. Ciprofloxacin is also a GABA antagonist, so it produces similar side effects like restlessness, seizures, headache, and drowsiness. A very important side effects of ciprofloxacin is tendinitis, tendon rupture, and cartilage damage. This is the reason why ciprofloxacin is contraindicated in small children, infants, and in the elderly age group. Ciprofloxacin is also a microsomal enzyme inhibitor. This is important because this can lead to the therapeutic failure of another drug which is given with ciprofloxacin. The most important side effects of the second generation fluoroquinolones is that they have an arrhythmogenic potential, which means that they can cause arrhythmias. And sparfloxacin, specifically sparfloxacin, leads to an increased QT interval, and it can also cause phototoxicity. So that was it for quinolones. I hope you gained something out of this video. Thank you for watching.